Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for June 12th, 2024. My name is Julia Gruss. I am a research project coordinator at KU's Center for Public Partnerships and Research and will be your webinar facilitator for today. I am also joined by Brianna Houston, who is a wonderful research project specialist for CPPR, and she will be monitoring our chat today as well as dropping any relevant links that you see on your screen into the chat for you to utilize as well. Getting started, as always, please sign up to receive our All In for Kansas Kids e-newsletter. You can do so on the Children's Cabinet website at www.kschildrenscabinet.org. Today, we have a wonderful presentation from another CPPR colleague of mine, Chris Tilden, who will be presenting on the KDHE Title V Needs Assessment. And really, without any further ado, Chris, we will pass it right off to you and you can get started.
All right, thank you, Julia, and welcome everyone. I'm delighted to have an opportunity to talk a little bit about the Title V, also known as the Maternal and Child Health Needs Assessment. And please, I hope for this to be an informal dialogue. So if you have questions or if you have ideas or insights, I certainly don't anticipate that it's important to wait until the end. Feel free to come off mute to ask questions or to put those in the chat. Or if you've got anything to share, would love to hear, because this is a process where we're gathering insights, ideas, and perspectives from people across the state. Well, let's go to the next slide. I want to back up a little bit and talk about the MCH needs assessment in the context of the Maternal and Child Health Block Grant, which is federal funding that supports this work. You might see the acronym MCHBG as up in the left-hand corner. Thought I'd talk a little bit about what this block grant is. As I noted already, it is a federal block grant program. The purpose is to allocate money to states to promote the health of women and children. It's a non-competitive program. Each state is eligible to receive funding. It is also the oldest and the largest state public health block grant program in the country, having been funded since 1935 under Title V, thus the name of the program, Title V of the Social Security Act. And the funding to states is again, it's a non-competitive grant. States that apply do receive money, and those monies are based on a formula that's based both on the size of the population of that state and based on some indicators of need of the health of women, infants, and children in the state. And as I noted, given the size of this block grant program, it is a very large program, estimated to serve about 60 million people annually across the country. It's estimated that 93% of all pregnant women, almost all infants, and about 2/3, 61% of children nationwide are served by recipients of block grant funding. Next slide, please. The Title V or MCH program in Kansas, as Julia already noted, is housed at KDHE in the Bureau of Family Health. In state fiscal year 2025, the program in Kansas is funding 55 local programs that receive grant funding from KDHE to provide services. And the primary goal of the program is to reduce infant deaths, focusing on things like safe sleep, breastfeeding, infant and maternal mortality, promoting access to care for eligible populations, which are women, infants, children, all the way up through adolescence, And also there's a specific focus on promoting the coordination of care for children with special health care needs. And the federal program is very flexible in terms of how monies can be allocated at the state and local level to address those goals. But there is a federal requirement that states spend at least 30% of the funds provided to the state, that 30% of those block grant dollars are utilized to ensure services are provided to children and youth with special health care needs. Next slide. So the needs assessment, what is the need for a needs assessment related to maternal and child health? First off, there is a requirement by the federal program that as part of the maternal and child health block grant application, every 5 years, each state must complete a comprehensive needs assessment that they include in their block grant application. And states are required to include information in the needs assessment about, first, the population health status of MCH populations. What's working well, and where are there potential issues or concerns related to the population health status of women, of infants, children, and adolescents. We're also supposed to look at the program capacity and structure to ensure that there is sufficient capacity to carry out the analytic work, the provision of services, and all of the administrative tasks also associated with project work. There's a specific emphasis on addressing workforce capacity and workforce development, because in the MCH program, as is true in many spaces related to programming for early childhood and young families, there is concerns about workforce capacity, particularly in some of our more rural and frontier communities. We are supposed to look at the partnerships and collaboration that form the basis of the program. We certainly recognize that the MCH programs themselves are just a small part of the overall program, providing a part of the overall system that's providing care to these populations. So partnerships and collaboration are obviously really key to doing the work. And then identifying what are priority needs that need to be addressed through the program, and then commenting on their linkage to performance measures, because the federal government does have a well-defined, long-established set of performance measures that states use to track progress of their program in relation to those measures. So when we conduct a comprehensive needs assessment, we are supposed to demonstrate that we have a clear structure to assemble the data that goes into the work. We need to engage stakeholders in a meaningful way, and to engage stakeholders that represent diverse communities. There has to be a structured priority setting process in place, and that process needs to be designed to ensure the involvement of families in diverse communities, and to ensure that the needs assessment is part of an ongoing process that involves collaborative planning, evaluation, and continuous quality improvement. So these very much are plans that do not sit on a shelf, and very much guide programmatic work over the 5-year life cycle that happens between each 5 years when the state needs assessment is submitted as part of the block grant application. Next slide, please. I noted the importance of partnerships, and there are many, many partnerships that would be identified as key to the MCH program, but I wanted to highlight a little bit of the structure of the program as it relates to project partners. I already noted that the MCH program is housed in the Bureau of Family Health at KDHE, and have a number of staff that manage the program at a state level. The oversight of the program from a statewide perspective happens within the context of a statewide MCH council that is represented by a tremendously diverse array of providers, groups representing various populations served by the program, policymakers, and others. That group meets on a quarterly basis and provides much of the insight that goes into the development of the needs assessment and the action plan that is associated with it. CPPR, where Julia and Brianna and I work, our role in this process is to coordinate the conduct of the needs assessment, to serve as the principal lead agency, gathering the data, synthesizing the data, and then providing that to the MCH program, the statewide MCH council, and other players who are involved in this work. And another key player at the federal level is the Maternal and Child Health Block Grant Program, and those staff, which is part of HRSA in the federal government, they play a very active role that begins with the evaluation of each application each year. There's an in-depth process where both staff from the MCH program and external evaluators do a comprehensive review of those applications, spend a full day with programs talking about strengths, weaknesses, and opportunity to improve, and then are very engaged on an ongoing basis in ensuring that states have the resources that they need to manage programs effectively and successfully. Next slide. So I'm going to provide a little context because we don't start in a vacuum when we begin a needs assessment process. So I'm going to step back and talk a little bit about the last 5-year needs assessment, which was completed in 2020 and covers the period of time 2021 through 2025. One of the things I wanted to highlight on this slide is simply the very extensive and comprehensive nature of data that help inform the work. So if you look at the list on the left-hand side, which is the quantitative data, i.e. the numbers that we gather to kind of provide information about the number of people served, the types of services provided. Those quantitative data are a key part of the work, but also qualitative data is also really key as well. Someone is calling, so I need to turn that off. Sorry about that. Loud ringer that I apparently had not turned off. Can you hear me okay? Am I still yes. Coming through okay?
You're all good, Chris.
All right, awesome. I think I was talking about the qualitative data. We in addition to the numbers that we, oh gosh, I am terribly sorry about that. All right, third time's a charm. The qualitative information that we collected included first what we called semi-structured focus groups with the local MCH programs. We met, I think, on a regional basis with the MCH programs, the local programs who are providing those services, to ask questions about what is working well, what are the challenges, who are the populations that you're having a hard time reaching, or that have persistent disparities that we need to address. We also did a lot of interviews with other key content experts that we felt had insight that would be helpful in putting together the needs assessment. The adolescence has historically been a difficult population to serve with the program, to reach in a comprehensive fashion. And also there's a real desire to ensure that youth who have fresh and interesting insights can really be part of driving program development. So there was a lot of focus on adolescents, and we did focus groups where we talked with a lot of adolescent groups around the state. And we also did a unique photo voice project where we not only talked with youth, but we asked them to collect photos of things that impact health in their community and put together photo assemblages and had them talk about using those photos, the things that they're seeing that really impact their lives, their health, and the lives of their families. We also utilized story collection from Our Tomorrows that I think a lot of you have heard about because we've used that for a variety of needs assessment, including the recent early childhood systems building work. A wonderful way to get insight in using with people's own words about things that are impacting their health and well-being. And there are an awful lot of reports that we tried to take existing findings and analyze themes and integrate those into the report. So as you can see, we're using an awful lot of different methods, and I thought I would use the last needs assessment as a way to kind of highlight what some of those methods are that we have historically used. Why don't we move to the next slide? I wanted to put up this slide as one more kind of example of data collection methods, in part because it's something that we are also doing again in this cycle. And so I'll talk about it in a few slides related to our current work in the summer of 2024. But one of the things we thought was where we were able to talk with an awful lot of Kansans and to collect some really interesting insights was a series of regional open houses that, as you can see in this picture, these weren't sit-down meetings where we went through kind of like what's influencing your health, what are the issues. Rather, we developed a set of what we called stations, color-coded, as you can see in the pictures, where we asked questions in a variety of ways to gather insight. For instance, the green table in the picture on the right was a budgeting exercise where we actually gave play money to participants and said, okay, so you've got these 9 issues that are fundamental to good health among women, infants, and children. Like, how would you allocate these dollars if you had those dollars to spend and had to allocate those among the issues? So just an idea of one kind of station that we developed for that exercise, and got some great insight as we have done that work. Next slide. We had a unique opportunity, I guess I would say, in that not only did we do a full assessment 5 years ago, but in 2022, we were asked to conduct an interim assessment that I don't think heretofore there had ever been an assessment of that kind, where rather than waiting for the 5-year cycle to complete itself, that we did a more limited scope interim assessment. And the tools that we used, the methods we used were a much more limited set of tools. We really did focus in part on a workforce analysis because we recognized that the pandemic had a really significant impact on the public health and other programs that were providing these services across the state. And so we did a relatively extensive workforce analysis, and that included one, as we always do, first an analysis of the aid to local applications. Those are the applications that local programs submit to KDHE to request funding. It has a lot of information about the proposed workforce that will serve the needs of the area population. And we also did a detailed workforce survey of local MCH program staff that provided some great insights. We also did a survey, which we had not done in the previous 5 years, a statewide survey asking questions of people in the MCH population, asking women, asking adolescents to complete a survey related to their concerns, their goals, their aspirations as it related to health. And also there was a real, there was a lot of information that was available to us, as there had been a couple of years before, with kind of a group of new reports that included the early childhood systems building needs assessment, a readiness assessment of McVie, which is focused on home visiting in our state, the Healthy Kansans 2030 report, which is coordinated by KDHE and looks at 10-year goals for improving health and well-being of people in a given state. There were some really important reports, like the report of the Governor's Commission on Racial Equity and Justice. The Institute for Policy and Social Research in 2022 produced a report specifically on the status of women in Kansas. So we had a lot of really great information that had already been collected also at our disposal. So that interim assessment was I think, a very valuable and interesting exercise. And the next couple slides, this isn't about what we found, but I did want to present a couple of slides that talk a little bit about some of the themes that came out of the analysis. So if you have, go ahead and advance the slide, and I'll share a few insights. I think for any of you that have been part of these webinars and have heard anything about the early childhood needs assessment work, I don't think it will surprise you to hear that one of the things that we heard in the survey of MCH population was simply that children and families are struggling with basic needs. I threw up a few statistics which really weren't part of the assessment, but I think kind of provide a little insight into that issue. If you look, for instance, 15.1% of Kansas children, a significant number, 15 out of every 100 Kansas children, live below the poverty line. And there's real disparities in that. For Black and African American children, that number is literally close to a third. For Latino and Hispanic children, it's about 1 in 5, 21.4%. So it's not hard to look at these statistics and understand why it is that families may struggle to make ends meet. We also have relatively low participation in some of the programs like SNAP for food benefits, or TANF. A fairly small number of Kansas families that are taking advantage of those programs. And I also provided on the right-hand side a 2024 statistic that I think is one that should be of concern to all of us, and that is, with the ending of some of the guidelines or some of the rules around Medicaid eligibility that the federal government put in place during the pandemic to ensure that there was coverage. As that process has unwinded in March of 2024, there were close to over 300,000 Kansas families who needed to reapply for Medicaid coverage. Fortunately, about 298,000 of those enrollees have renewed their coverage, but at this point, there are over 66,000 who are determined to no longer be eligible, another 13,000 who are in a reinstatement window and at this point in time do not have coverage, and another 86,000 who require a renewal application and will need to submit a complete application in order to have their coverage. So this represents yet another area where there are a considerable number of Kansas families potentially at risk for losing a really important benefit, Medicaid, that can help meet their health needs. Next slide, please. I noted that looking at program capacity was something that was really important to our work. And as you can see on this slide, it gives you a sense of why there is a concern, and that is that the number of counties that were served by the program did drop substantially. In 2020, there were 76 counties with direct services from those local MCH programs. That had dropped to 62 counties in 2023 when we completed our analysis. And if you look at maternal and child health universal home visiting, which is one aspect, an important aspect of these programs, it also had decreased from 64 to 52 counties. So there definitely was some decrease in simply the number of counties that were being served by local programs. Next slide. I also noted workforce, and as you might ascertain, given that there were less programs, there were also less people serving the MCH population across the state. But what I chose to highlight here was not only that we have less people in those roles, but it also, like in many fields, was an aging workforce with a significant number of individuals, nearing retirement age. Also an application that's predominantly white compared to the populations that they serve. The MCH population, the staff population looks pretty close to what the state looks like. But if you look at the population of the MCH program itself, it serves a much higher percentage of racial and ethnic minorities, with around a third of those being served, for instance, being Latino and Hispanic families are not as well represented in the MCH staff that serve those programs. And in our survey, we also found that MCH professionals likely expressed a very high degree of satisfaction with their work. And at the same time, 1 in 4 said they were still likely to change positions. Some of the reasons cited were just were stress associated with work in public health that face some, I think, incredibly stressful times during COVID, but is, always a really tough job. Concern about compensation is often cited as well. But the bottom line being that we have a lot of MCH professionals who feel good about their work, but are still considering potentially moving into a different position or moving into a different line of work altogether. Next slide. So I'm going to talk about a little bit about our current process. And yes, we are going to collect a lot of information in a similar manner to what we have in previous years. On the left-hand side, for instance, there's a lot of great census data that are available that give us a perspective on what are the demographics, what are the changing demographics of the state in terms of looking at women, infants, children. What kind of trends are we seeing in urban versus rural communities? What kind of trends are we seeing in Western versus Eastern Kansas? Looking very closely at that information. The epidemiological staff at KDHE collect an awful lot of information on health status through a variety of programs, both in the MCH program and in vital statistics and other programs, and we utilize an awful lot of that data. We'll interview and assess the aid to local applications. The client level data for the MCH programs resides in DAISY, and we are able to access those client level data so as to look at the kinds of services that are being provided and where there might be gaps. We're obviously talking with the MCH programs through focus groups and other means. We've really appreciated the photo voice work that I mentioned earlier, where we had adolescents share not only their stories, but visually represented ways that their health is impacted by things they see and experience in their communities. So we're replicating that. I think the biggest change in emphasis this time around is that we recognize that there are persistent disparities, urban and rural disparities based on race and ethnicity. And so we are doing, I think, more interviews and more focus groups this time around, ensuring that we are talking with and hearing from and integrating the experience and the voice of those with lived experience who can shed light on some of the challenges that they face and some of the ways that they feel these needs could be better addressed. And then ensuring that we're trying to integrate this work into the vast array of other statewide assessments, some of which I've mentioned. There have been others that I didn't include, things like the Title X or the reproductive health assessment. But most of you are probably familiar with, and I've covered quite a few assessments, and we want to make sure that we're integrating the direction and the goals of the MCH program with that other work being done with those populations as well. I did mention earlier that we are doing these regional open houses again. We have done 4 so far. We were in Garden City, in Hayes, Salina, and in Wichita over the last couple of weeks, and had some great interaction with and great participation from both families and providers that participated in those regional open houses. But if you are in Southeast Kansas, or if you're in Northeast Kansas and have an opportunity to go to Kansas City or to Pittsburgh, at the end of this month, we will be doing 2 more regional open houses, one on June 27th at the Kansas City Library, and on June 28th, we will be at the library in Pittsburgh. So I would welcome any of you that are in those communities or nearby to come join us and to share your perspectives. And would also highlight this email at the bottom of the page, kucppr-mch.edu, because as I said, we're looking to include a diverse perspective of provider and people with lived experience, clients of programs, people who could potentially be served by these programs. And so those voices are a critical part of this process. We would welcome to have your involvement in this program. So if you have questions or insights you would like to share, one central place you can go is this KUCPPR MCH email address. Feel free to email us at any time if you have questions, insights, want to invite us to be part of an event where you feel like we could talk with members of your community to gather information about their perceived health needs, concerns, and issues. We're welcome to ideas and insights. So please use that. Please feel free to share it. So just a little bit about next steps, and that is in the remainder of 2024, we will be completing the needs assessment, which will also then, I mentioned earlier on, part of the exercise is prioritization. Those priorities become part of a 5-year state action plan. That will also be part of the needs assessment. That will be submitted as part of the block grant application next year. There will be a public comment period, so there will be an opportunity. In fact, if you are interested in providing comment and seeing what is happening in 2024 in the statewide MCH application, that application is available for public comment as we speak. So if you go to this email address below, the www.kansasmch.org, you can find information on the current state fiscal year 2024 application. If you'd like to read about what they plan to do this year and to provide public comment, this is an opportunity. And the 2025, it'll be 12 months before we will actually have an open public comment period on the application that will include the needs assessment that we're currently conducting. So with that, I think I am at the last slide, if I am not mistaken. So if anyone does have any feedback, or if you have any questions, happy to entertain those there. but I've also included my email address as well as that of Silke von Essenwein, who is another applied research staff member at KDHE, who she is actually the coordinator at CPPR coordinating this work, and I am kind of serving in the lead evaluator capacity. So feel free to reach out to either of us individually, or feel free to use that MCH needs assessment email that I have on the left. And with that, I will stop and see if I can field any questions or if anyone has any concerns or insights they would like to share.
Yes, feel free to come off mute if anybody has anything to say or utilize the chat feature. And I will just call attention again to the email address on your screen, the kucppr-mch@ku.edu. So if you have anything that pops up after today, you can always send them an email there, and they can respond and answer any questions or comments that you might have. Not seeing anything in the chat now, so we might just move on. But again, send an email to that email on your screen if you have anything for Chris and Silke, who have been diligently working on this Title V needs assessment with a small group of other colleagues at CPPR as well. Thank you so much for your time today, Chris. We appreciate you and everything you shared with us. And we've got to thank you for sharing this great information from Lisa Williams in the chat as well. Alrighty, I'm gonna move on because I just have a few early childhood systems updates for you. First, a community-based child abuse and neglect prevention, the CBCAP. There is funding available that supports primary and secondary prevention efforts. Primary prevention includes efforts targeted to the broader community to strengthen families and prevent the likelihood of abuse and neglect, while secondary prevention efforts are targeted to special populations as a means of providing preventative family strengthening support. So through the Children's Cabinet website, you can learn more about the funding for community-based and statewide projects. Brianna will drop that link in the chat, and applications for this funding are due by June 28th. Community-based funding requests can range from $50,000 up to $300,000, while the statewide funding requests can range from $50,000 up to $400,000. So just wanted to make everyone aware of this funding opportunity that will be closing on June 28th. Next, we have the Kansas MTSS alignment, which is the multi-tier system of supports and alignment. This is a term used in Kansas to describe how schools go about creating a system to provide supports for each child in their building to be successful, and the processes and tools used to make these decisions. Kansas MTSS and alignment offers professional training opportunities throughout the school year. So to learn more about those professional training opportunities and to find other resources, you can visit the Kansas Technical Assistance System Network website. Brianna will put that link in the chat for you as well. So if you are interested in checking out any of those professional training opportunities, you can do so. And next, Greenbush is proud to introduce their Communities Helping Communities, third Thursdays at 3. This is a year-long series that will be packed full of live virtual presentations on a wide variety of ways that you can help support and improve your community. So always held on the third Thursday of the month at 3 p.m. You can follow the link in the chat to go and visit the Greenbush website, that you can learn about the sessions that they are providing and the presenters that will be at each one of those sessions on the third Thursday at 3. Next up, we have some information on our parent and caregiver fireside chats that are happening monthly. And I actually have Cora Unger here from KDHE. She is the Title V Children with Special Healthcare Needs Director at KDHE, and she is going to share about this opportunity with y'all and let you know what is coming up on June 24th. So Cora, you go right ahead.
Awesome. Thank you for the introduction. If my audio is cutting out because I have video on, let me know. My internet has been a little wonky today. So the parent and caregiver fireside chats have been being hosted by KU, CPPR, and KDHE as part of the family leadership team and Help Me Grow work. In the fall of 2023, we hosted a series of roundtable discussions with families. And we found that they really loved having the opportunity to have open discussion and share about services for their families. And something they asked for was to be able, to have more information and to have the opportunities to learn about systems and programs across the state. So out of that, we had this plan to offer a free monthly fireside chat where we could invite someone to speak about a service or program directed for families, to families for families, and where they could have some Q&A session or also some open discussion around the topics that are being presented. So we do capture some information during these sessions to be able to create and present a community spotlight piece on the All In for Kansas Kids website, which is under the Communities tab for anyone to access. We also have some information to create a fast facts sheet for parents and caregivers about whichever topic we had covered during that fireside chat. So up until now, we have had 3 sessions, and our topics have been 1-800-CHILDREN. We did a topic on screenings like the ASQ and the ASQ3SE, and also around home visiting programs. So this next one is going to be on services for children ages 5 to 8. And all of these are, generally speaking, the 4th Monday held in the evening for families to join from 6 to 7 p.m. And as the slide says, we'll be having a save the date and a registration link coming out soon for anyone who's interested in attending. And if you have any questions, you can reach out to me at any time.
Thank you so much, Cora. Yes, do not forget to register for that parent and caregiver fireside chat. You should find that registration link in your next All In for Kansas Kids weekly e-newsletter. Next up, we have another webinar that we want to promote from the Stellar Insights team, and I have Haley Pomerico from the Center for Public Partnerships and Research as well, who is going to give us some insight on this webinar and what they are doing with this early childhood data webinar series. Haley, go right ahead.
Great. Thanks, Julia. Yeah, like Julia said, my name is Haley Pomerico, and I'm a project coordinator at CPPR. I am excited to share that we have our next webinar in the Stellar Insights series on Tuesday, June 25th from 3 to 4. This one is called Information for Connections, Referral and Resource Networks. So in this webinar, attendees will get to learn about the role that resource and referral networks have in sharing information and creating connections. We have Rachel Harper and Michelle Reichart of Kansas Children's Service League and Loretta Severin from CPPR to join us to discuss 1-800-CHILDREN and IRIS, which is the integrated referral and intake system. They'll share how they're collaborating to help connect families to the right service at the right time. So you'll get to learn a little bit about each system, and then there will be a Q&A facilitated by CPPR's Jared Barton. So it should be an insightful and informative webinar, and we're excited and we hope to see you there. Thanks.
Thank you so much, Haley. Yes, again, the registration link for that is in the chat. So if you are interested in joining them at the webinar on June 25th on information for connections, resource and referral networks, you can go ahead and register there. Reminders and next steps for some of our upcoming meetings. Our early childhood recommendations panel for June will be held on Friday, June 21st, from 9 to 11:30 a.m. The next early childhood systems building webinar is going to be held on Wednesday, July 10th. And for that webinar, we will have an update on the Kansas early learning standards and the core competencies. So please come join us for those updates. And then the next Children's Cabinet meeting is not until Friday, August 2nd. And you can find all of these meetings and more on the Children's Cabinet YouTube channel, where you can find the live streams or the recordings of those meetings after the fact. So thank you so much for joining us today. Ways that you can stay up to date with us: sign up for the All In for Kansas Kids e-newsletter. You can follow us on Twitter, otherwise known as X, and you can subscribe to the Kansas Children's Cabinet YouTube channel. So stay up to date with us, and hopefully we will see you back here next month on July 10th. Thank you so much for joining us today, and I hope you have a great rest of your week.